Sir, make video on Botox and fillers. Definitely I will make. But see now the Botox and fillers, why we are not doing regularly, even in our center, we are not practicing regularly because they are all short-lived. It stays for only some weeks or some days, sometimes maximum 1 or 2 months. That's it. After that again you need these injections repeatedly. So now those things generally if you need repeatedly, then it may not help you for a long term basis. So now more than that, treating the underlying cause will definitely help us. See, Botox is only for, generally we give for premature ejaculation to desensitize the tip of the glans penis. So there are so many other more safe solutions, like either switch technique or penile selective denervation, or if there is too much of infection in the prostate, we can do shockwave therapy. They will give you long-term results. That is the reason we are not using Botox or fillers. They are expensive and you may need repeated treatments. So one more question: if venous ligation surgery or venous stripping works in some patients, as you told in one of your videos, that will work in 70% of cases. So with this, venous leakage can be permanently cured and strong and natural erection can be restored just like a normal healthy man. See, nowadays venous ligation for venous leak we are not doing regularly, and not only we, most of the urologists stop doing that, because see what happens, there are so many veins in the penis. So now if there is one vein which is damaged, you block that vein, tomorrow other vein may get damaged and blood may start leaking. So then you can't go on doing surgery for each and every vein. If you ligate all the veins, then there will be penile edema, then blood can't go back. So single sitting you can't close all the veins. So that is the reason nowadays we stop doing venous ligation surgery, because it can't give you permanent solution. And not only us, most of the reputed institutes in the world, they stop doing venous ligation nowadays. One more question: can tadalafil 5 mg be taken lifelong for mild venous leakage, or at some point of time the body will not accept and start resisting the medicine and medicine stops working? See, now as long as your problem is under control, that means, see, if there is testosterone deficiency, or if there is a vitamin D deficiency or vitamin B12 deficiency, as long as you are correcting them and taking tadalafil, generally it works for lifelong. But what happens is, suppose if you are a diabetic, if you are in hypertensive, or if you have a vascular disease which keeps on damaging the penile blood vessels, now then after some time, because of the severity in the damage, 5 mg may not work. So then you have to take 7.5 mg or 10 mg. So it all depends on what is your underlying cause. If your underlying cause is very minor and the problem was already sorted out, then 5 mg will work for lifelong. But if there is diabetes, if you are not maintaining the diabetes properly, or if you are a smoker continuously smoking, then damage will go on. So after some time tadalafil may not work. So you try to find out the underlying cause, and then we have to see. If there are patients where we start with 5 mg, after some time they say they start taking 2.5 mg. 2.5 mg also works for many people. So you can see, we can go down, if it is working very well, 5 mg is working very well, then you can go down to 2.5 mg and see. If 2.5 mg is also working, then you continue 2.5 mg.